Hi, my name is Adrian. I am performing the pediatric assessment on a preschooler. Today is February 14th, 2021. I'm going to have her scan the room. Okay. Ready? Okay. So. Hi. How are you?
Good.
Good. My name is Adrian. I'm going to be your nurse today, okay?
Okay.
I'm going to come in and I'm just going to check you out. Is that okay?
Okay.
Okay. So I'm going to go wash my hands. I'm going to provide for privacy and make sure we have adequate lighting, okay?
Okay.
Okay. Providing for privacy. Okay. Can you tell me your name?
Elena.
And how old are you?
5.
Good job. Do you know when you were born?
February 27.
Good job. Do you know where we're at right now?
Adrian's house.
Good job. Okay. So I'm gonna have gloves on, okay? So first I'm just gonna start by looking at you. I'm just seeing what you're wearing. I'm looking at your posture. Can you sit up straight for me? Good job. Okay. I'm looking at your facial expressions. Are you doing good today?
Mm-hmm.
Yeah. Okay. Okay. So now what I'm going to be doing is I'm going to be assessing your skin. Okay. So first I'm just going to start by looking at your skin, checking everything out. Can you pull your sleeves up for me? Do you have any bruises or anything?
No.
No? Right. Okay. Good job. I'm going to look at your back too, okay? Make sure my hands are. I'm going to go ahead and feel it. I'm going to be looking, when I feel it, I'm feeling for temperature, any moisture, or color changes, okay? Is there any tenderness?
No.
Okay. Okay. So, if I found like a bruise or like a cut or something, I would use a acronym called ABCDE. A stands for symmetry, B stands for border, C stands for color, B stands for diameter, and E stands for evolving. But I didn't note anything, so that's good. Your hands are a little dry though. Have they been that dry before? Yeah. Okay. So I don't have the equipment, but now I would do vital signs. So I would get your pulse, which is your heartbeat. Your respiration is your breathing. I would get your temperature and yeah. Okay, so I don't have everything, but a normal respiration on a preschooler is 22 to 34. A normal heart rate on a preschooler is 80 to 140. And the normal temperature, we usually check oral or axillary, which is under your armpit. That is 98.6 to 99.5. Okay? I'm good? Okay. So now we did your skin. I'm going to be looking at your head, okay? So I have gloves on. I'm just going to be inspecting and I'm going to be feeling your head, okay? Is there any tenderness?
No.
Okay. I don't note any lesions. Okay. Okay, so now we're going to be moving. Oh, I'm going to feel your temporal pulse too. Okay, so now we're going to be moving to your eyes. So I'm just going to be looking at your eyes. I'm looking at your eyelashes. You know what that is? And then your eyebrows. Okay. I'm also looking at your pupils and the white outer parts, which is your scleria. Okay. I don't note any abnormalities. So now what I'm going to be doing is I'm going to be looking at your. I'm going to pull down your eyelids and I need you to look up. Okay. Okay. It appears pink, moist, no drainage, which is good. So now, have you seen one of these before?
No.
Okay. So this is a pin light. It shines a light. So I'm going to be shining this in your eye, okay? I'm going to be looking to make sure that your pupils, which are the black things in your eye, that they shrink when I shine the light in them. Okay? I'm also going to be, when I'm assessing it, I'm going to be looking at PERLA, which stands for your pupils are round, equal, reactive, and they accommodate, okay? I know that's a lot of information. Okay, so I'm gonna have you look at my nose. Bright light, okay? Okay. Good job. Your pupils are PERLA and they do have a consensual response, which means when I shine the light in one eye, the other eye shrinks as well. So now we're going to be moving to your nose. So I'm just going to be inspecting your nose, looking for any deviations. Is it okay if I feel your nose? Okay. Does it hurt anywhere?
No.
You're not very talkative. Okay, so now what I'm going to do is make sure that you can breathe out of your nose. So I'm going to hold one nostril and I want you to take a deep breath, okay? Tell me if you can smell. You still breathe out of it, right? Breathe out of it? Okay. So now we are going to move to your face. And so what I'm going to have you do is just smile for me. Are you tired? Okay, and then can you try to raise your eyebrows? Good job. Frown for me. Okay, I'm going to be looking at your, can you smile again? This is your nasolabial folds. That's your smile lines. And then smile with your eyes. This is your papular fissulas. Okay? Okay, so now we're going to move, and your facial expressions are symmetrical. So now we're going to move to your mouth, okay? So I'm just going to have you open your mouth. I'm going to shine a light in here. Okay, I'm looking at your top plate, your bottom, looking at your teeth. Okay, now stick your tongue out. Okay, and say ah. Looking at your uvula and your tonsils. And then if I needed to, with gloves, I would palpate. It's not suggested to use a tongue blade, especially with infants, but if needed, I would. Okay, so everything looks symmetrical, teeth look good, no lesions, everything looks good, okay?
Okay.
So now, I'm going to be looking at your ears. Okay, so I'm just going to be making sure that they're symmetrical on both sides. Okay, I'm looking at the structure, landmarks, any abnormalities, color, temperature. Okay, so now I'm going to palpate them, okay? Like feel them. I'm going to feel them. Okay, so I'm going to do the arculus, mastroid, which is behind, the earlobe. Any pain?
No.
Good. Okay, and then if needed, I would use an ophthalmoscope, which is the thing that they put in your ear, you know, and they shine a light, and I would take a look in each ear, making sure that everything looks well, okay? Okay, so now what we're going to do is we are going to move on to your lungs, okay?
Okay.
So, first I'm just, are you tired?
I'm too.
Okay, so first I'm just going to take a look at your chest. Can you breathe normal for me? Okay, so what I was looking for is I'm looking for size, shape, symmetry, any abnormalities with the breathing, okay? But it looks like everything's symmetrical. So now I'm going to go ahead and palpate. I'm just feeling for like temperature, any tenderness. Is there any tenderness when I touch you?
No.
Okay. Skin is not, it's warm, but not too warm, no moisture, which is good. So now I'm going to be taking a listen to your lungs. Have you seen one of these before?
Yeah.
Okay, so this is a stethoscope. I'm going to be placing this thing, this is the diaphragm, I'm going to be placing it in 3 locations, okay? So technically, when you're listening to the lungs, you have 12 locations on the front, 12 locations on the back, and then you have 3 locations on the right, because there's 3 lobes in the right lung, and then 2 on the left. For this assessment, I'm going to be listening to 1 in the front, 1 in the back, and then 1 on the left. Okay? So when I do this, I want you to take a deep breath like this. Okay?
Okay.
I'll tell you when. Okay, do it. the lateral. Okay, so I was listening for normal and adventitious sounds. Your lungs are clear bilateral throughout, which is good. There's no adventitious sounds. Am I making you tired? Okay, so now we're going to move to the heart. Remember this? So with the heart, just sit there normal. I'm just going to be assessing for any pulsations, heaves, anything like that, lifts. So none are noted. So what I'm going to be doing is I'm going to be listening to 5 locations on your heart, okay? And I'm going to be listening for at least a second or 2 on each location just to make sure that your heart's normal, okay? It is normal for children to have murmurs. So we're going to go ahead and take a listen, okay? Just breathe normal. No. Okay, come out of your arm. Okay. Rhythm was regular. There were S1 and S2 was heard. There was no abnormalities, so there's no bad things. Okay? Okay, so now we're going to move to your belly. Can I have you lay up here for me? Okay, so is it okay if I pull your shirt up? Yeah. Oh, no. Okay, so first I'm going to start by just inspecting. I'm just going to be looking at symmetry. I'm going to look at your belly button, making sure the contour is right. Okay, everything looks within normal limits. So the next thing that I'm going to do is I'm going to take a listen, okay? I'm going to start in your right lower quadrant and go around and listen for your bowel sounds, okay?
Okay.
Originally I would listen for one full minute, but for this assessment I'm going to listen for 30 seconds in each quadrant. Okay, ready? No tenderness, right?
No.
Okay. Bowel sounds are present. They are normal active. Normal active is anywhere from 5 to 30 per second or per minute. Okay, so now what we're gonna do is I'm gonna feel your belly, okay? And you said there's no tenderness?
Mhm.
Okay. So first I'm just gonna start with like light palpation. And then if there was tender spots, I would do those last, okay? Okay, now I'm gonna go a little bit deeper, okay? Okay. Pull this down. So now I'm going to be looking at your peripheral vascular system, which is like your lower extremities. And remember the cap refill that I talked about? When I press down on your nail, it turns white and then red. That means you have good circulation. Okay? So I'm going to check that. And it appears that you have less than 3 seconds, which is good. I'm going to do it to your toes too, okay? Okay. And then with the peripheral vascular system, I'm just going to be looking at your lower extremities, looking at skin distribution, if there's any ulcerations, which appears to not be. So now I'm going to feel your pulses, okay? So I'm going to start with your carotid pulse. Okay. Then I'm going to move to your brachial pulse. Okay, then your radial pulse. Okay, and then I'm not going to do this, but usually for an assessment you have the femoral pulses and then the inguinal lymph nodes. The femoral pulse is like right in there, and then if I was assessing the inguinal lymph nodes, I would rotate. Okay?
Okay.
So now I'm going to go to the popliteal. This one's kind of hard to assess. Okay. Now I'm going to go to the dorsal pedal. Okay, and then the posttibula. Okay, I'm gonna have you set up for me. I'm gonna finish assessing your lymph nodes, okay? These are on your face. Okay, so I'm just gonna do circular motions, okay?
Okay.
So this is your preocular. Just let me know if there's any tenderness, okay? Your postocular. This is your tonsillar. Your submental. Submandibular. Occipital is in the back at the base of the skull. Posterior cervical. Anterior cervical. And then your the clavicle, supraclavicle. Was there any tenderness?
No.
Okay. So your pulses were +2, which is good. Normal rhythm. No lymph nodes were felt. Everything looks good. So now we're going to move on to range of motion. So I'm going to have you stand up. I'm going to assess your musculoskeletal system. Okay, so first we're going to start with your shoulders. Can you kind of move them around? Yeah, can you go backwards? There we go. You raise your arm up and raise your arm down. Okay, can you do this with your elbows? Okay, so now let's move our wrists. Okay, and then move our fingers. Okay, I'm going to look at your spine. Just making sure that it's in correct alignment. Can you bend down for me like this? Okay, back up. Your spine is in alignment. Okay, so now I'm going to have you lay down for me and we're going to do some more range of motion, okay? Okay, so now I'm going to can you bring your knees up? Yep, now back down. Okay, now I'm going to do the Aguilar's test, okay? So just let me move your leg, okay? Okay. No resistance is met, which is good. Range of motion is intact. Okay, bend those knees. Okay, so now can we move our ankles, remember? Kind of twist them. There we go. And now with our toes, twist your toes. Good job. So, range of motion is intact. No musculoskeletal issues at this time. So now we're going to move on to the cranial nerves, okay? So can I have you sit on the side of the bed for me? Okay, so first we're going to start with cranial nerve 1, which is the olfactory. So that's your sense of smell. So what I'm going to do is I'm going to have you close your eyes, and I'm going to hold one nostril and you tell me if you can smell it, okay? Or what it smells like. What's it smell like? Like lotion?
Yeah.
Okay. I will go to the next one. Close your eyes. Does it smell like lotion as well?
Mm-hmm.
Okay, good. So that's cranial nerve 1. Now we're going to go to cranial nerve 2, which is the ocular. So for that, I would use like a Snellen chart, which is a chart, which you've done before. A chart on the wall where you cover one eye, and then you have to read down the line and cover the other eye, and that tests your vision. That's cranial nerve 2, which is the optic. Cranial nerve 3, which is the ocular motor. That's what I did with the pen light. I'll go ahead and do that again. You look at my nose. Okay, I'm assessing for perla, making sure that the pupils are consensual, which they are. I know it's bright, isn't it? Okay, cranial nerve 4 and 6 is the trochlear and the abducis. And then cranial nerve 5, or the trochlear and abducis is the 6 cardinal gazes. So what I'm going to have you do is I'm going to have you follow my finger, okay? Without moving your head. Okay, so that's intact. Next is cranial nerve 5, which is the trigeminal. So I'm going to have you close your eyes. I'm going to touch different locations in your body, and I want you to tell me when you feel it, okay? Okay, and did that feel sharp?
Yeah.
Okay, good job. Okay, so cranial nerve 7 is your facial, because we already did 6 with the abducis, with the 6 cardinal gazes. So cranial nerve 7 is your facial. So I'm going to have you smile, frown, raise your eyebrows, puff your cheeks. Okay, so everything seems symmetrical, which is good. Now we're going to go ahead and jump to cranial nerve 9 and 10. Cranial nerve 9 is the the glossopharyngeal, and cranial nerve 10 is the vagus. So I'm just going to be taking a look in your mouth again. I'm going to have you open your mouth. Okay, stick your tongue out. Say ah. Looking at the uvula. At this time, if needed, I would initiate the gag reflex. Also looking at your tonsils. Okay. So now we're going to skip to cranial nerve 12, which is the hypoglossal. So for this one, I'm going to have you stick your tongue out and go side to side. Okay, so that is intact. Next, we're going to do cranial nerve 8, which is the acoustic, which is the hearing. So I'm going to have you cover one side. I'm going to come to the other side and whisper some things, and I want you to tell me what you hear, and we'll switch. Okay? Okay, so close your eyes. Cover an ear.
A, B, C, D, E.
Okay, next ear.
My name is Adrian.
Good job. Okay. So lastly is cranial nerve 11, and that's your spinal. So what I'm going to do is I am going to apply resistance, and I want you to shrug your shoulders against me. Push, 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 push. Good job. Okay, relax. Okay, I think that sums it up. Do you need anything from me?
No.
Okay, you did well. I'm going to go ahead and wash my hands and document, okay?